We're going to be talking today about how Kenan Advantage Group implemented Surgery Plus, so a COE or specialty network, in order to give access to high quality care, make care more affordable, and then save some money at the same time. So Leah's going to start with an overview of the organization. Then Michael will talk about how Lockton came in to help them make a decision. And then we'll share some early results on results to date. Surgery Plus was launched last July, so it's still early on, but a lot of promising results so far. Just for additional introductions, I'm Evelyne Giguere. I'm an actuary by background. I spent about 20 years at WTW, or Willis Towers Watson, and I joined Employer Direct Healthcare last fall.
Michael Faughnan with Lockton and have been in the consulting industry helping employers address many issues around their employee benefit plans for over 30 years. And Kenan Advantage Group, I'm not just saying this because they're up here, is one of my favorite clients. It's a great organization to work with, and you'll hear more about them and some strategies we use to help them manage that benefit plan.
All right. Good morning, everyone. My name is Leah Pilolli, and I'm the benefits manager at Kenan Advantage Group. So I'm going to get us started today. So Kenan Advantage Group, or also known as KAG, is North America's largest tank truck transporter and logistics provider. Try and say that 10 times fast. It's pretty tough. But we have over 300 locations and over 7,000 employees, 4,800 of which are on our benefit plans today. Within our organization, we have 6 distinct business units. That includes KAG Energy, Specialty Products, Merchant Gas, Food Products, KAG Canada, and Logistics. Amongst those divisions, we transport all sorts of material and products ranging from gas to crude oil, diesel, pet food ingredients, chocolate, cement additives, you name it, we are involved in some nature. And we do touch almost every industry. We have a rather large footprint, and that continues to expand as we continue to grow through acquisitions and private fleet conversions. At KAG, one of our biggest priorities is our people. So that is something that we focus on within the benefits department when we're planning our strategy. So we value employees' feedback so much that we conducted focus groups last summer to collect feedback on what is most meaningful to our employees as far as their plans go, so that we can keep that front of mind when we're making decisions on what changes do we make and what programs do we add. We currently partner with Anthem as one of our medical carriers. We also, as Evelyn mentioned, partnered with Hinge Health and Surgery Plus just starting last summer. So we launched in July, and when we launched, we adopted the program as a voluntary program, meaning if someone had an eligible surgery, they didn't have to go through Surgery Plus. It's completely voluntary. We also adopted an incentive structure that allowed our employees on the PPO plan that we offer to pay $0 towards any eligible surgery. For those of our employees on the high deductible health plan, they do have to meet that IRS minimum, but Surgery Plus does it in a way that they take all of the employees' spend at the beginning of the year for the previous year, and they see if they met that deductible naturally just through other plan utilization. If they didn't meet it, they have to pay that difference, and if they met it, they don't have to pay anything either. So just a little bit more about KAG. So we face some challenges, as I'm sure everyone here does, and of those challenges, one of our biggest challenge is the cost that we're seeing on the plans, the medical and the RX plan. So we are constantly trying to come up with ways to address that, which we'll dive into here. Additionally, in the transportation industry, turnover is very high. So we're constantly battling high turnover, so trying to attract, retain, and engage our employees so that we can keep them at KAG. We also have an aging workforce, so we have to really be aware of those chronic conditions that our employees are facing. There's definitely a higher prevalence. And of the top 5 chronic conditions our employees have, the second highest is musculoskeletal. So that definitely led us down the path towards Surgery Plus. So given these challenges that we face, we are making it our goal, and have in the past and continue in the future, to make it our goal to offer comprehensive benefits that attract and retain, but also maximize results and help us control our costs. Okay, so this slide goes a little bit further into the cost challenges that we faced. So you'll see in the chart over the last 5 years, our costs have grown over time and significantly increased over the last 2. Some factors driving these cost increase: delayed care from COVID, which I'm sure everyone has experienced to some degree. We've seen a huge uptick in cancer and other chronic conditions. We also have the normal impact that, again, everyone's probably seeing as well from medical inflation. So all of the contract pressures and costs being pushed off onto the plans. We have so far taken traditional measures to address these cost increases. So increasing employee premiums, looking at the deductibles, and so on. However, over the last couple of years, KAG and Lockton have partnered to look at things like chronic care management programs, specialty networks, and virtual care. That way we can have some innovative ways to tackle these cost challenges. So I'm actually going to turn it over to Mike to talk about what that process looked like when Lockton was partnering with KAG to evaluate options to control our costs, including Surgery Plus.
Thank you. Make sure I can operate that. So a little plug on Lockton. We're the largest privately held insurance and benefit consulting firm. What that means to me, I've been there for a little over 13 years, and it's where I'm going to end my career, is because there's not layers of management. There's 3 focuses: help your clients, develop your associates, and give back to your community. And I think those are really strong pillars to build a culture around. And it enables me, and I always say this, I don't really work for Lockton. I work for the 10 or 12 clients that I serve, one of them being KAG. And just some comments on KAG. They have a terrific management team, because when we come in to make decisions around the employees, they come at it from different perspectives. Safety is key because of the industry they're in. Efficiency is very important to them in managing their cost. But equally as important is the employees and what is best for the employees. And their management team represents those aspects in everything they do. And Leah heads the benefits team. And those of you that are tasked with managing your employee healthcare plan know that it is a challenge, particularly now. We're coming out of COVID. We're seeing inflationary pressures hit the hospital systems, hit other providers, and we've maximized a lot of the cost sharing. So as we develop solutions, it's about efficiency versus just purely cost shifting. And there's a lot of challenges around this because we have a very inefficient, fragmented delivery system. But benefit leaders like Leah are tasked to answer to the finance department and answer to the employees. And that is a difficult balancing act. So I'm going to talk just a little bit of how we approach working with employers around their health plan. And I was an economics major, so I always talk about everything in supply and demand. And on the demand side of trying to manage a benefit plan, we do things to reduce that demand. It may be promoting wellness so people stay healthy. It may be managing health risks. It may be directing people to more efficient providers, because all these things will raise the demand for healthcare if they're not managed effectively and raise prices. And as employee benefit plans are approaching double digits, or the business growth may not be growing at that pace, that's what creates the conflict. On the supply side, it's managing your suppliers of healthcare. And there's other things that you can do to keep those healthcare costs down. Those of you involved with benefits, you go through your renewals every year. You're negotiating fixed fees, administrative fees. There's other fees that are in the plan. They're relatively small in comparison. There's an element of insurance and stop loss that can get negotiated. But really the biggest lever that an employer has is how they manage their provider network. And as you look at how it's developing, there are options, but with these options to achieve savings, there's costs. Cost in the sense that is reducing access, maybe infringing on the employee experience. So I'm just going to talk briefly about kind of the network development. I've been in the industry for a long, long time, and remember when everybody was forced into HMOs in the early 90s, it didn't work. We then gravitated to this broad delivery of a PPO. And probably many of your plans are in some sort of PPO with a broad network. And over the years, we've taken steps. And these steps can have a pretty significant impact on your cost structure. You can move to the best-in-class broad-based PPO. You can move to high-performing networks, which in some locations may reduce provider choice by up to 40%. You may do some direct contracting if you have a large segment of your population in one location and you evaluate that delivery system and develop some direct. All of these are really efficient models to help drive down costs. But again, it impacts the employee experience. Lastly, I'll talk about centers of excellence and alternative specialty networks like a Surgery Plus. And this is, I'm going to talk why we brought this to Kenan. I've had experience with Surgery Plus. It's probably going back 8 years when they were just starting to get traction. As you think about what we've done with our benefit plans, we largely, over the last 15 years, moved our members into some level of a high deductible plan. We used to call them consumer-driven plans because we thought, well, let's put a $2,000, $3,000, $4,000 deductible and they'll make really good choices, right? But in essence, what we're doing is giving employees kind of the ID card, which is like a credit card, and say, consume as much health care as you want, just make good decisions. What we found is these aren't always great decisions because it's really hard to understand quality. We don't necessarily pay attention to cost, and it has led to some care not being provided that should be, and it's really challenging for employees. So as we look at this, for plan sponsors, you have an opportunity to bring more consumerism, like direct that consumerism within your plan. And I'm going to talk about kind of the disparity. Like we think of, oh, is my provider in a network? That must mean they're high quality and somebody negotiated good terms for reimbursement. But we looked at within the same network, the different cost reimbursements that's negotiated by your health plan. And there's significant difference. And how you direct that care has an impact, not only on quality, but certainly on cost. And so as I pulled this slide, I looked at the procedure. I said, well, I actually have some experience with some of these. I don't consume a lot of healthcare, but as you get older, you start to consume more. So the first one was a sleep study. Apparently I snore, right? And for years of getting a kidney punch from my wife in the middle of the night, she said, she's a nurse, right? So she's the clinician in the family. She said, I think you have sleep apnea. You need to get a sleep study. And so I went to my primary care physician and said, yeah, I'm going to recommend a sleep study. So I get there, and I don't know if anybody's done this. You spend a night and they hook you up to these things. But I went to check in. And being a good consumer, I'm in a high deductible plan with a $5,000 deductible, so I'm going to say I'm going to practice what I kind of preach. And I said, how much is this going to cost? He said, well, if you run it through your insurance, it's $2,600, but if you want to pay cash, it's $1,500. I'm going, shouldn't it work the other way? My health plan had negotiated really good rates. I sit in all these meetings and said, hey, we got you 50, 60% discount. So much to my wife's chagrin, I said, this is kind of shady. And I actually left, and it took me another 6 months to have my sleep study. So another experience I have, and this kind of speaks to how we make selections, I had a knee scope, right? You see the knee surgery up there. And so I was a high school wrestler. I tore my cartilage in my knee. And years later, I'm like bothered by the knee. So I went to my primary care physician, and he was able to order a scan, and he said, you need to see an orthopedic. I think you might have to get this cleaned out. I go, I don't know if that's a medical term, cleaned out, but okay. And so a couple weeks later, I'm at my sister's house for a barbecue, and she's saying, my neighbor's an orthopedic surgeon, and I live in Colorado, and we're in Boulder, and he goes in, and he's actually operating on some of the CU football players. So, okay. So I start talking to him, and he goes, yeah, come in. And sure enough, he's going to rescope my knee. And we get into the operating room, and I'm still awake, and he starts praying over my knee. Now, I'm supportive of prayer, but he's praying like somebody's going to kick a field goal and there's 2 seconds left. And I'm like, this is the guy I chose. Maybe I should have rethought, like, over a couple beers at my sister's barbecue, is this the surgeon I want for my knee? Everything went great, but it kind of underscores the lack of consumerism we have in our selection of care that we get. And if you look at price and quality, there is not a correlation to say, well, if I'm spending more, I'm going to get high quality. And this is the need to bring some level of consumer elements as a plan sponsor to say, what can we do to address better quality at better cost? And this is where I engaged with Surgery Plus years ago, because they talked about their model. And it's one that focuses on quality of the provider. They are looking at a lot of information and data to segment top quality providers. They are looking at the experience that the member has, because it's a very fragmented system and it's not always easy to navigate, and that concierge that can be provided is very helpful. Looking at providing access, right? Because if you have to travel for relatively straightforward procedures, you're probably not going to want to do that. So having strong access to providers is very important. And obviously the cost. And I'm going to talk about how I verified their cost, because it didn't make sense to me that when you hear these providers or these healthcare plans negotiating with these providers, and they're saying we're getting the best price, how can you come in and get such a better price on the reimbursements versus what the health plans are doing? And there's some rationale behind that that was explained to me, and I said, yes, this makes some sense. It is payment within 5 days. It is lack of some of the requirements that health plans will put on providers through that payment process. And what providers are finding out with these high deductible plans, there's a lot of people that may approach elective surgery or another procedure and say, this is going to cost me $2,000, $3,000. I don't have that money right now. And they'll choose not to have it. So providers will have scheduling issues. So it kind of made sense that if you had another approach with providers, you could drive some savings. I'm going to talk about how I verified that savings in a second. So as we worked with Kenan, it was really important that we identify these areas, how they selected quality, whether they provided access, what was going to be the member experience, and where we're going to get the savings that is being developed. So this is an illustration of how we mapped out locations where Surgery Plus was to provide alternatives. It didn't appear it would require high travel. We went through the concierge service that Evelyne will talk a little bit more later, and we developed some cost savings. The savings is calculated this way. I was a statistics major and an economics major, and really focus on how do you get to this savings projection. And so there is roughly 20 to 25% of the spend that could be directed to Surgery Plus. The savings is somewhere between 30 to 50% on those procedures. So if you can get 25% of your spend and you're saving 40, 50%, that could be as high as a 10% overall savings in the plan. But really, you're not going to get that level of utilization when you initially put in. It's going to be relatively low. So we did those calculations and we targeted somewhere in the neighborhood of 1%, which is about $300,000. But we anticipate that that will grow as these plans get more traction. So I just want to talk real briefly on how I verify this, because I'm a skeptic in a lot of looking at what we call point solutions and other solutions that are brought forth. And so when I initially got involved in understanding Surgery Plus's business model, I was skeptical whether they could achieve the savings and negotiate the terms of their reimbursement and how that compared to commercial plans. And they showed me all this data. They said, hey, you had actuaries verify this and all this, but I never trust it until I can experience it. So I actually would look at the reports for a client I worked with several years ago who put it in, and I pulled the data that they were being charged for, and then I went on the website of various health plans where you can estimate the cost and said, okay, if I'm in Dallas, Texas, and I'm gonna have this procedure, there's many models you can look and say, what's the estimate of this cost based on these reimbursements? And by and large, this is some of the results that I found when I put in hip replacement. And these models will enable you to bundle this, so it is a relatively fair comparison. So the savings is there, and this was the primary reason we brought it forth to Kenan Advantage Group, because again, they're very focused on balancing efficiency and achieving efficiency before they're tasked with cost shifting to their employees. So I'll turn it over to Evelyn.
Thanks, Michael. So we're going to talk about the rollout and the solution that Kenan launched last July. Before we do that, I just want to take a step back and explain who we are as an organization. You've heard Leah and Michael say Surgery Plus, and you're hearing me say I'm here with Employer Direct Healthcare. Employer Direct Healthcare is the name of the organization. Surgery Plus is our product. We're focused on helping members get to quality care in the moments that matter most, and that's defined as surgical spend or procedures, but also cancer. We won't touch on cancer today, but we have a product called Cancer Care Direct, which is focused on giving members access to high quality care and navigating through cancer. As Michael mentioned, we've been around for a while. We've been around for about 12 years now. We have over 5 million members, covering almost 400 employers. And when the employers come to us, they implement our solutions. They save money, their members are happy, and their members are saving money, so our retention rate is really high. Some of our clients are up, the logos are up here. You'll see we work with Aetna, CVS as an employer. So the CVS employees actually access our solution when they're seeking surgical care. We also work across a lot of different industries for different reasons, right? So we work with retailers like Home Depot or Dollar General. Our solution really resonates because we're providing access to equitable care. It's affordable and it saves a lot of money. But we work across different industries, some white collar, some blue collar. Employers are seeking different things. We heard Leah say cost management was really important. Some employers are focused on navigation to high quality surgeons and the member experience. And so we can really help employers achieve both. We've integrated with most large health plans. And by integration, it could be everything from just sending eligibility file, but also sharing data, accumulators for plan designs, clinical data so that we understand who's coming to us and how to do targeted outreach. United is on here. We have a partnership with them from a contracting standpoint. So if you have United Healthcare as a health plan today, you're able to add Surgery Plus with a contract amendment, so really easy implementation. We've also integrated with other point solution and navigation vendors. So I won't read the logos. A lot of these are either contractual relationships. So again, if you have their solution, you can add ours easily or vice versa. But also we're always focused on making sure the member experience is top-notch. We want, our care advocates to understand a client's ecosystem so that we can help the member navigate from one solution to another when they're coming to us but actually don't need surgery. I'm going to take a step back and say, what did we implement for Kenan, but also what is a COE, right? What are we doing? And ultimately, our goal is to provide access to high-quality care to those members. Most members are calling us, and our care advocates are all located in Dallas. So they are speaking to a human that's here in the United States, that is trained for empathy and really understanding benefit plans. So we have 160 care advocates today. The member feedback that we get is really high, so our NPS score, and that is not Leah and benefit managers rating us, they rate us too, but it's really the members or the patients that are rating their experience with care advocates. Our care advocates' goal is to guide our member or our patient to high quality care. So once the patient explains, here are my needs, I might need a knee scope or a knee replacement, the care advocate is then going to say, here are the surgeons that we recommend that are closest to your house. We'll send bios, and the member is going to be able to make the decision of which surgeon they'd like to work with. From there, the care advocate is going to help them navigate, make appointments, fill out the right questionnaires, travel, everything is figured out for the member. We're really focused on that white glove experience. Michael talked about our network of surgeons, and it's true, it's really hard as a patient to understand quality, right? We spend a lot of time making restaurant reservations and figuring out the best restaurant for a special dinner. I spend a lot of time on Amazon trying to figure out which gifts to get for my kids, and I read a lot of reviews, but you can't really read a lot of reviews when it comes to doctors. And so we do that for our members. We take a surgeon's first approach to finding high quality care, which means we don't start with the health systems and then, contract with them. We actually curate the network of surgeons that we work with. The hospitals are not the ones performing the surgeries. It's the surgeons themselves. So we want to go after the best surgeons to join our network. And because we do that, we get really high quality, and high quality are high outcomes. And good outcomes means two things. It means surgical avoidance, right? A lot of people think they need surgery, but they actually don't. And that's a great result. When they do need surgery, our quality is so high that our complication rates are under 1%. And the complication rates for surgeries are actually really high. It's 8 to 15. So if you think 1 in 10 is expected to have a bad outcome for a surgical procedure, I feel like as a patient, if I knew that, seeking the high quality surgeon would be really important. So we're proud of our outcomes. Michael talked about the geo-access. So several of you have sought new health plan partnerships, and a geo-access is always part of that, right? Is the network broad enough? Does the map of where those doctors are overlap with where my employees live? The same analysis is done in this case to make sure that the Kenan employees can find providers that are close to home. And Michael mentioned this, if the surgeon isn't close enough, the member's not going to come to our doctor, right? Being accessible is really important. So over 98% of members actually just drive to our centers of excellence. And the state of Alaska is a client, and in Alaska, no one gets to drive because everyone is coming into the continental United States to get care, and that's included in the 2% of our members who fly. When travel is needed, the care advocate is going to do everything for the member, whether that's sending a debit card for gas money, booking a hotel for an early morning appointment, or plane tickets when that kind of travel is needed. Inclusivity is listed up on the slide. That's really big for us. We want to make sure that when a patient comes to one of our doctors, the doctor can help them, right? And so a lot of patients come to us, they think they need that knee replacement, but that's not what they need. The contracting structure that we have with our doctor allows the surgeon to care for that member, even if the surgery isn't what's needed. And so we're not then having to navigate the member back to the doctor that they originally went to for a more conservative path of care. Just another note on being equitable and accessible. The priority when we set our network is to be available close to home because people might have second jobs, they might have caregiving responsibilities, they could be a single parent, or they could be caring for aging parent. If you have any of those things, traveling for care that's not close to your house isn't available to you, right? Even if Kenan were to say, we're gonna cover the cost of that travel, the member is going to forego care or is going to seek care closer to home. So when we set our networks, we always keep that in mind. As an actuary, also a skeptic, like Michael noted, the last factor here is, I think, what brought me to employer direct healthcare. We can save our members and our plan sponsors a lot of money. Right? We're seeing $15 per employee per month. That's very meaningful, and we'll get into a little bit more detail as to how we do this and how we validate those numbers. But what we've seen, these are results for 2022. As Leah mentioned, that can be a full voluntary program that is still saving that amount of money. And for most of our clients, that can be about 2% of medical spend. So we only touch a fraction of the spend, but we're able to tackle 2% of your spend. So if you think about your pricing and your budgeting projections for 2025, if you're working on this now or in the next couple months, if your cost of care is going up 7 or 8% next year, you could implement a solution like this COE that could bring that down 1 or 2 points. Leah touched at a high level of what Kenan chose to implement. They followed a lot of our best practices, which are to waive full cost sharing when members come to us for those procedures. By doing that, it incentivizes use of the COE, and the plan sponsor is going to save enough money that they are saving too, right? Everyone gets to save. For a PPO type plan, that means you waive everything. For a high deductible health plan, again, you collect the minimum, the $1,600 for 2024, and then waive everything else. Leah mentioned this too, but they implemented our full suite of solution, which is all the surgical networks that we have. Today we cover, the most common ones are cardiac, bariatric, spine, and joint, but we also cover any type of plannable procedure. So if you think about hysterectomies, colonoscopies, ENT type procedures, gallbladder, they are all part of our network. And so we're able to meet the demands of a lot of members. But again, all on a voluntary basis. Kenan also followed our best practice communications. I'll say, as an employer, we only get paid when members are utilizing the services and when employers are saving. And so we've really nailed down how to communicate to those members to make sure that they're aware of our services. It starts with an ID card around open enrollment. We get traction, people calling in wondering, hey, I got an ID card, but I'm not sure what this is. Am I paying for this? What's this service? And so our care advocates are there to educate the employees. We also do quarterly mailings. For Kenan, we have posters, and so we'll do as much communication as possible, and we can also try to be more targeted too if we get the data from the medical plan. I won't read it to you, but this is our standard kind of recommended travel benefit. Again, our care advocate will book the travel when travel is required. But in most cases, there's no travel required aside from, driving to a doctor's office. And this is kind of the money slide. So Michael talked about how he did his own analysis, and I'll show here kind of the numbers that we use. But to give you an example, the average cost of a knee surgery is around $18,500 through Medicare. But unfortunately, as plan sponsors, you don't access Medicare rates. You are paying about 3 times the Medicare price, so that's around $44,000. At Surgery Plus, we're able to negotiate contracts that are between the 100 and 130% of Medicare. And Michael talked a little bit about how we do that. I think the biggest factor, it's not that we're paying the claims immediately. The hospitals like to have money right away, but it's mostly because we're able to steer care, right? We have 5 million members. When we contract in a specific area, we are contracting with one hospital or a set of doctors, and so we get to pit them against each other, and so that drives costs down. We're able to funnel members that would have received care at Hospital A instead of going to Hospital B, filling out empty beds that Hospital B already has. It's pretty small up there, but you'll see that ultimately it's the facility rates that are going down by 50 to 60%. We're not cutting back on surgeon rates or anesthesiology rates, that the rest of the doctors probably wouldn't want to work with us. On the right side of the slide, you'll see some of the savings. These are all 2023 results. The top section is similar to what Kenan implemented. It's a full voluntary model, which means people can continue to use their Anthem plan or their health plan that you offer and just offer our solution alongside. For the Home Depot, we generated about $25 million in savings. Oh, they're in the second model now, so I'll move to the second. Home Depot implemented our standard model. This is probably our most prominent now, a voluntary model with the exception of bariatric. Bariatric is often something that employers choose or choose not to cover. And if they do, sometimes they mandate the use of a COE through a health plan. And so when those organizations come to us, our recommendation is just do the same thing, continue to offer our plans as voluntary, but make it mandatory for the care of bariatric. In those cases, we're saving above $20 on a per employee per month basis. The last section, this is a voluntary model, but it's mandatory for hip, joint, spine, and bariatric. You'll see the savings are very significant. This is not our recommended approach for all employers. I think there are very few that should go down this path. Hyatt hotel chain during the pandemic needed to do something really drastic. They implemented that model. Nevada Gold Mines is on here with several $100s. The cost of care is very high in their area. They have near-site clinic, and those near-site clinic almost exclusively steer to our surgeons. So there are really creative ways that you can implement the plans and make sure that you're saving a lot of money. We're going to jump into the results for Kenan. So this was launched last July, and we're presenting results through December. So overall, I think the experience was really good. I'll caveat this by saying this was launched in July. People don't call and get a surgery on day one. They call, they get information, they get a consult, maybe a couple weeks later, and then surgical care. So it takes time. We'll see the results continue to progress throughout the year. We've had 22 great outcomes. We've had great member stories. All of the care that we've provided has been local, so no one's needed to fly because the overlap of our network and where the Kenan employees live matches really well. We've had a couple people where we've booked hotel rooms for them. We do that if you have an early appointment with a specialist or if you have surgery and then might need a follow-up the next day. We want you to be really comfortable. So far, we've saved about $9 per employee per month. And we've also saved members a lot of money because they've been able to access care for free. Leah's going to talk about just some employee stories.
Yes, so I've had the opportunity to talk to a handful of employees that actually use the program, and the majority of those were our drivers, so they don't hold back. They're wonderful people, but they will be brutally honest, and overall, all of the feedback has been very positive. So the first and the loudest theme of the feedback was the cost, which you'll see on the slide. They were very pleased with the fact that they didn't have to pay anything to have the surgery. And I even heard from someone that said, I would have never had that surgery had this program not existed. So their quality of life is now changed, and hopefully their inclination to stay with us has also increased as well. Another area where we received a lot of positive feedback is the care advocates. As Evelyn mentioned, they took care of everything for our employees, so they were very relieved that they were not only prompt, but they were very informative. They took care of all the logistics, made it super uncomplicated when it could be a very complicated and confusing process. So very pleased overall with the care advocates. Another area where we got a lot of positive feedback was the facility where they received the surgery and the surgeon as well. Some of the ways they described their providers and the facilities were best of the best, world-renowned, top-notch, and for them to realize that through their experience really shows us that they are high quality. So overall, every person I spoke with highly recommended it, so much so that we're actually seeing in our data that the highest cited reason people find out about Surgery Plus is through word of mouth. So it's speaking for itself, and we really, although we're doing the communications, we're really not needing to do a whole lot outside of the standard communication plan because employees are so impressed with it that they just are sharing the word amongst themselves.
And I think we see that with a lot of clients, and Michael mentioned in the savings projection, we expect the savings to continue to go up, not just throughout year one, but over time as more and more members come to us for care. I mentioned we cover colonoscopies. Colonoscopies aren't something that people think about, calling a center of excellence to, but one of the reasons why we cover colonoscopies is that it's generally the middle-aged demographic that is also going to maybe need a knee scope or a knee replacement in the future, right? And so these become return members for us. We'll switch to financial result. I mentioned the good outcomes. Overall, surgery avoidance is always our preferred approach, but when there is a surgery, we want the members to have a really high quality or high quality event. Some of the results to date are really promising. So again, this is 6 months of a new solution. I'll say I spent 20 years in Michael's shoes as a consultant. There are not a lot of solutions out there that, from day one can be this impactful. And maybe not impactful when you think about the few employees that we're helping, right? It's a relatively small population, but really impactful from a member experience, but also a cost savings potential. The numbers are a little small, but you'll see on the slide, we've had 16 surgeries so far. We've saved almost $260,000. The projections that we had done for Michael and for Kenan last summer were very, very, very conservative. I think we were planning $300,000 in savings for year one. I think we're always conservative because we know that our projections can be used in underwriting and elsewhere, but we're at 260 for 6 months, so we're likely going to more than double the expected savings for the year. And then lastly, just wanted to show how members are engaging with us. So you'll see, we got a lot of tractions. The lines are a little bit hard to see, but in July, got a lot of traction getting calls in to our care advocates, likely because they had received a Surgery Plus ID card. And they had heard about the benefit during open enrollment. We had one of our account managers actually go to Kenan for benefit fairs as well to answer employee questions. And then we expect the traction to continue to go up throughout the year, right, with the number of consults going up, a little bit down in December. I think it's a month where people have a lot of other competing priorities, but continue to track up through the remainder of the year. So we are kind of at the end of our content. Wanted to see if anyone had questions to ask to any one of us.
This is really great information. Thank you very much. I'd like to know a little bit more about kind of the after surgery. What happens with, some of the outcomes, and then is there any monitoring of kind of the patient? Is there readmission rates? The 30 days with Medicare, and then kind of like the success. 1, 3, 5 years after the surgery. Do you monitor that? Is there a solution there?
We monitor all outcomes, right? So I mentioned our complication rate is 0.6%, so far below 1%, far below the industry norms of 8 to 15. So we monitor our own outcomes. These are episodes of care, so the care advocate stays connected to the patient for several months after the surgery. Obviously we'll help schedule follow-up visits with the specialist, right? Because the surgery happens. The event that we are covering will include, post-op and follow-up visits with the surgeon. So the member stays connected to us as an organization and to the surgeon.